Hello and welcome. Today we're diving into a common yet often overlooked condition, noise-induced hearing loss or NIHL. This is a type of hearing loss that develops over time due to exposure to loud sounds. Understanding NIHL is crucial for protecting your hearing and maintaining your quality of life. We'll explore what causes it, how it affects your ears, what to look out for, and most importantly, how to prevent it. So, what exactly causes noise-induced hearing loss? The primary culprit is prolonged or intense exposure to loud sounds. This can include occupational hazards like working in construction, factories, or with heavy machinery. Recreational activities, such as attending loud concerts, using firearms, riding motorcycles, or even listening to music at high volumes through headphones, can also contribute significantly. The louder the sound and the longer the exposure, the greater the risk of developing NIHL. To understand how NIHL develops, let's take a look inside your ear. Within the inner ear is the cochlea, a snail-shaped structure lined with tiny hair cells. These hair cells are responsible for converting sound vibrations into electrical signals that the brain interprets as sound. When exposed to loud noise, these delicate hair cells can become damaged or even destroyed. Unfortunately, these hair cells don't regenerate in humans. The resulting damage leads to permanent hearing loss, often starting with the higher frequencies. Noise-induced hearing loss is a widespread issue. Millions of people worldwide are affected, making it one of the most common causes of preventable hearing loss. Individuals working in noisy environments, military personnel, musicians, and even young adults who frequently listen to loud music are particularly at risk. The prevalence is increasing, especially among younger populations, likely due to the widespread use of personal audio devices. The signs and symptoms of noise-induced hearing loss can develop gradually, making them easy to miss at first. Common symptoms include difficulty hearing high-pitched sounds, such as birds chirping or women's voices. You may also experience muffled speech, trouble understanding conversations in noisy environments, and tinnitus, which is a ringing, buzzing, or roaring sound in the ears. Sometimes, there is a temporary threshold shift right after noise exposure, which usually resolves, but with repeated exposure can turn permanent. Diagnosing noise-induced hearing loss typically involves a comprehensive hearing test performed by an audiologist. This usually includes pure tone audiometry, which measures your ability to hear different frequencies, and speech audiometry, which assesses your ability to understand spoken words. An otoscopic exam is also performed to ensure the ear canal is clear and to check the eardrum. The results of these tests will help determine the extent and pattern of any hearing loss. Noise-induced hearing loss can be broadly categorized based on the degree of hearing loss. Mild hearing loss may only affect faint sounds, while moderate to severe hearing loss can make it difficult to hear normal conversation. Profound hearing loss may require the use of hearing aids or cochlear implants. The classification helps audiologists tailor the most appropriate intervention strategy. Unfortunately, there's no cure for noise-induced hearing loss. Once the hair cells are damaged, they don't grow back. Therefore, treatment focuses on managing the symptoms and preventing further damage. This may involve the use of hearing aids to amplify sounds, counseling to cope with hearing loss, and strategies to improve communication skills. In some cases, tinnitus management techniques may also be beneficial. The best approach to noise-induced hearing loss is prevention. Protecting your ears from loud noise is crucial. Wear earplugs or earmuffs when exposed to loud sounds, whether at work, concerts, or while using power tools. Limit your exposure time to loud noises. Give your ears regular breaks in quiet environments to recover. Lower the volume on your personal audio devices, and consider using noise-canceling headphones. The prognosis for noise-induced hearing loss depends on the severity of the damage and the individual's adherence to preventive measures. While existing hearing loss is permanent, taking steps to protect your hearing can prevent further deterioration. Recent research is exploring potential regenerative therapies for hair cells, but these are still in the early stages of development. Advances in hearing aid technology and cochlear implants continue to improve the quality of life for those with significant hearing loss.